Hello, and welcome to the Cancer Research Institute Cancer Immunotherapy and You patient webinar series. Today is Wednesday, October 17th. I'm here with Stephen Estrada and Mary Elizabeth Williams to speak about how to advocate for yourself. Before we begin, I'd like to thank our generous sponsors who have made this webinar series possible. Bristol Myers Squibb, with additional support from Regeneron, Sanofi Genzyme, and Adaptimmune. My name is Caroline, and I'm the Associate Director of Patient Engagement at the Cancer Research Institute, a nonprofit organization established over 65 years ago with the mission to save more lives by funding research that aims to harness the immune system's power to conquer all cancers. This work has contributed to the development of life-saving immunotherapies for a variety of cancer types. We present this webinar series to patients and caregivers to help contribute to the educational resources available regarding what immunotherapy is and how it differs from other treatments, to provide information on the latest developments in research, and to connect patients to immunotherapy clinical trials. Now it is my pleasure to introduce today's guests, Stephen Estrada and Mary Elizabeth Williams. Just by way of introduction, Stephen was diagnosed with stage 4 colon cancer at age 28. After surgery, chemotherapy, and a NanoKnife procedure, he enrolled in a clinical trial of an anti-PD-1 checkpoint inhibitor in 2015. Stephen has now been on the trial for over 3 years and has enjoyed being cancer-free for the last year and a half. Now Stephen has joined the Colorectal Cancer Alliance as Senior Coordinator of Community Engagement. He also became a certified patient navigator, helping educate patients about clinical trials and resources to help them with their own cancer journeys. Mary Elizabeth is a New York-based writer and mother of 2. She was diagnosed with melanoma in 2010. A year after surgery, she learned the cancer had metastasized to her lungs, and she enrolled in a clinical trial of a promising new immunotherapy being conducted at Memorial Sloan Kettering Cancer Center in New York City. The trial was a study of a combination of 2 checkpoint inhibitors for patients with metastatic melanoma. Within 3 months, she knew the treatment was working. She is also the author of a series of Catastrophes and Miracles, a true story of love, science, and cancer. So without further ado, Stephen, Mary, it's an honor to have you here with us today to share your insights on how to best advocate for yourselves. So I'd love for you to take over this discussion, and if we could begin the discussion with a conversation about your decision-making process. Mary Elizabeth, to begin, what was going on in your life when you were diagnosed with cancer, and how did you first learn about immunotherapy?
I'm glad you asked that question because I think a lot of times it feels like the healthcare system assumes that you have nothing else going on in your life when you receive a catastrophic diagnosis, and that suddenly your full-time job is going to be attending to your appointments and your treatments. And there is often a serious lack of understanding that we experience 99% of our cancer life outside of that doctor's office, outside of the hospital. And I think it's really important for us as patients to do everything we can to remind everyone on our team that we also have lives, that we are trying to get back to, that we are trying to extend as much as possible. I received my diagnosis at the beginning of the school year. I had a lot going on with my kids, and then we all got lice, and I was dealing with trying to figure out how to choose the best treatment options for me while I was also literally getting bugs picked out of my hair. I was extremely fortunate that I was at a hospital where a research trial was being conducted. I had a really great oncologist, and I had almost never heard of immunotherapy until I needed to hear about it. So it was a very rapid process for me. And I think much like Stephen, we were in a place where we were forced to make choices very quickly and forced to really assess what was going to be the best option because we didn't have the luxury of time. I don't know. What was your experience like, Stephen?
A lot like yours. It's strange. I was diagnosed at 28, and where I was at in my life, I had a great relationship. My career was really taking off. I was looking to get married and buy a house. And then, one day all of that comes crashing down. So my life came to a complete standstill. Once I was diagnosed with stage 4, I really had no concept of what cancer was or what treatment meant. As soon as they said stage 4, I asked out of how many stages, because I was blissfully ignorant of what was happening to me. My first oncologist was very textbook. She was just a few years younger or older than me, which nothing to do with age. I just felt like I needed someone with a little more experience who could think outside the box. I knew very early on that I wasn't textbook. My genetics, as I was learning, were a little different than most people's. So I really had to do a lot of my own research because my doctor was not going to do it for me. And through my own research, I stumbled upon, the buzzword immunotherapy. And I kept reading articles about how it's the biggest breakthrough since antibiotics. And this is going to do so much for cancer patients. And I knew at that moment that I needed to not only learn more, but learn if I could be a part of it. So I think that for a 28-year-old, I hit the books pretty hard, and I'm not one to read a whole lot. So it was difficult, but at the same time, very empowering.
Yeah, and I remember in 2016, you spoke about this a little bit at the Immunotherapy Patient Summit in New York about how you approach those conversations with your oncologist. And you spoke about how you knew that you couldn't rely on one doctor to have all of the answers. Could you tell me a little bit more about that, Stephen? And maybe specifically what advice would you give to other patients in approaching these conversations with their oncologist?
Sure. One thing I always tell patients is that doctors, they do their best, but at the end of the day, they're humans just like us. And unfortunately, to us, there are one person, but we are one of many to them. So it really falls on us to become educated and learn about what our cancer really is doing inside of our body. We all know that cancer is self. And so just kind of going along that logic, cancer is individualized amongst all of us. So I think that really starting that conversation comes from the knowledge of what's going on, not being scared to get onto Google and look at not statistics, but scientific data about, what's coming out, what's already there, what might be available to you. I think genetic testing opens up a lot of doors for those types of conversation. I know my oncologist says that a crucial test, an MSI high test, is not done by about 50% of people who come to see him for a second opinion. So what that tells me is we really, as patients, need to take charge of our own treatment plan. I use the metaphor that we are the coaches of the football team, and I don't watch much football, but the oncologists are our quarterbacks. And at the end of the day, we need to be the ones to tell them where we want to go. And if we don't accept their answer, there's a second opinion. There are a lot of oncologists out there who are forward thinking. And in this age of precision medicine, if your doctor is not willing to have conversations about genetic testing, clinical trials, I really encourage that patient to move on. Mary Elizabeth, was your experience with your oncologist similar?
Well, I was, as I said, extremely fortunate. I really just hit the jackpot in terms of my experience because I had an oncologist who was literally one floor down from where the future Nobel Prize winner James Allison was conducting research in immunotherapy at the time. So I came into it with the deck really stacked in my favor in terms of communication and in terms of access. But what I have seen in my own experience, even with the best of circumstances, and certainly seeing other people that I talk to in my cancer advocacy, is that regardless, you are still in a traumatic situation, that along with your cancer diagnosis, there is this secondary issue that you are dealing with, which is that your brain has now just been hit with a truly catastrophic event. And so anything that you can do to keep that in mind and understand that, like, wow, if I'm having trouble remembering what my doctor is saying, or I'm not understanding it, or I forget what happened, there's a reason. There is a cellular reason for that. It has to do with your brain chemistry. And it's really important at that moment, if you feel that you are in a vulnerable state, and you are, to use other devices to help you, to take notes ahead of time, to bring your questions written down before you go into a consult with your doctors, to bring someone with you who you trust as your advocate, who is not afraid to get up in their grill and ask questions when you are feeling just scared and overwhelmed, that it's okay to understand that you don't have all of the tools in your arsenal that you might usually in your day-to-day work, in your interactions in your job. This is not that kind of experience, and you need to really understand that it's okay to get as much extra outside help as you can.
Stephen, you also have spoken about how looking to your community for support was important to you throughout treatment, and especially now since you work as Senior Coordinator of Community Engagement at Colorectal Cancer Alliance. What would you tell patients in terms of engaging with a support community, and how did that help you personally with your own throughout your own treatment?
You know, I really credit my support community as the reason I'm still around today. When you're diagnosed, Mary Elizabeth hit it right on the head. When you're diagnosed, all your strengths that you may have in your day-to-day life, they go right out the window. And you need other people to really fill in those gaps for you. Fortunately for me, I have a partner of 10 years now that was there with me every step of the way, taking those notes and asking those questions that I just couldn't think about at the time. But then we really found ourselves relying on our colorectal cancer community, or as we call them at the Colorectal Cancer Alliance, our allies. I needed them to help me not just navigate this medical system, but to help navigate what it meant to be a survivor and what it meant to be someone who is now living, you know, a little bit in fear, and how to live through that fear. So I always encourage patients to reach out to other patients. You know, if you have a family support, that's wonderful. But at the end of the day, unless they're sharing your same diagnosis, they can't relate to you on that same level. You know, I think a perfect example of community is definitely when I was looking for a clinical trial. It was because of my community through the Colorectal Cancer Alliance that I stumbled upon the hospital that I'm now at and my oncologist that I'm now at, which then turned into the clinical trial, which I've been on for 3 years. You can't underestimate the power of community. And now in my new role at the Colorectal Cancer Alliance, it's such an honor to not just engage my community, but really sit down and relate to them and travel and hug them and listen to them and find out what they need from us as leaders in this community. And without our community, we're nothing. Mary Elizabeth, I imagine, though a different disease state, I can only imagine that the melanoma community is very engaged and very large. I'd love to hear more about your experiences.
Yeah, absolutely. It really does my heart good when I hear someone who is coming from such a similar perspective. Yes, the melanoma community is very special. I think the cancer community in general is, right? And we have, in the Venn diagram, we have our respective cancers, we have the immunotherapy, we have the wider just cancer community in general. What happened with me was very soon after my metastatic diagnosis was my whole family and I became involved in a support community. We became members of Gilda's Club. And two things that I would add to what you said was it became very clear very quickly that it was also very important for the people who were taking care of me to have people they could talk to, because the stress on your caregivers, on your family is also considerable, and they need help too in this experience. They need other people who they can relate to when the road gets really hard and when it feels really scary for them. And as you said, the other amazing thing about when you become part of a support community is you quickly learn that there are people you can lean on, and then you learn that there are people you can help. And that is tremendously empowering in a moment in your life where you may feel so helpless, to know that there are times you can go with your community, and when you're having maybe a better day, you can be there to offer some just support, love, just a shoulder to someone else. It's a very circular experience. It's what I think we as human beings are supposed to do, is give support, take support, find a penny, leave a penny. It's like that, but for support. And it's life-changing. And it is absolutely, as you said, it is an essential element of the healing process and of the treatment process, and going forward for the rest of what you hope is your life.
But, I really like that about caregivers. And that one part I didn't think to mention. Caregivers are the backbone of any cancer survivor. And there unfortunately are people who are doing this alone. So a support community really allows these people who wouldn't have anybody else to have a virtual caregiver. But I think it's very important for caregivers to be a part of their own support community where they have their own safe space, because there are certainly things that they have questions about that they don't want to discuss with us, and vice versa. And I think it's imperative for caregivers to really, really take care of themselves and know that it's okay to take care of themselves, because you cannot pour from an empty cup.
Absolutely.
Since you both participated in clinical trials, I was hoping to hear a little bit more about really the work that you did in joining those trials, what that experience was like for you, and again, any advice you might give to someone else in a similar position, sort of in that position of whether or not they want to or they will enroll in a trial.
I knew very early on that my stage 4 diagnosis was very terminal very quickly. And I knew that, again, because of my genetics, chemotherapy wasn't going to be, the lifesaver or the time extender that I really needed it to be. So clinical trials came into my diagnosis very, very early on. In fact, I really only completed one, the first line of treatment for colorectal cancer before jumping into an immunotherapy clinical trial. I will tell you that beyond a cancer diagnosis, signing your name on that dotted line might have been the second scariest thing I've ever done. Clinical trials, it's exactly what it sounds like. You're testing something new and hoping that there's some sort of result, and you're hoping that your body can handle the medicine. But when your back is up against the wall and you have no other decisions, I knew I had to take this chance. Fortunately, I found a doctor who is not only the head of clinical trials of where I go, but is also just a brilliant out-of-the-box thinker. And thanks to discussions with him, very, very honest and very frank discussions, I knew that signing up for this clinical trial was, my only option at that point. I knew that even if I passed away on the clinical trial, that my body would be, given to science, and hopefully what they learned from me could help a patient and potentially cure a patient down the road. Now, most clinical trials don't have the success that I have had. But a lot of them do have measurable success and life-extending success. I was just very, very fortunate that, genetics play a huge role in my treatment. And the cancer was eradicated through my trial. And I've been on it for 3 years now, celebrating 2 years of being cancer-free very shortly. And it's all in the name of science. And I think that the more patients we enroll into clinical trials early on, before they're at the end of the road, the more progress we're going to make. I think one of the major hurdles we're having right now is either oncologists don't want to talk about clinical trials, or they don't want to talk about it until the patient has run out of standard of care options, at which point they're generally too weak to even enroll in a trial. So my best advice to a patient is that as soon as you are diagnosed with cancer, be it stage realistically 2 to 4, but especially 4, you need to be learning about the clinical trial system and what genetics are and what biomarkers are. You need to have all that terminology in your back pocket as soon as possible, because the last thing you want to do is try to crowd your mind with all this terminology when you're at the end of the road. Mary Elizabeth, I'm very, very interested, because you were kind of a hub of immunotherapy. Did your clinical trial just kind of fall in your lap? Did you know what you're getting yourself into?
Not really, although it sounds like we had very similar origin stories, Stephen. We both had rapidly fatal stage 4 diagnoses that are chemo resistant. So it wasn't like the buffet table of options was really spread out for us in terms of what we were going to do with regard to our choices. I also would add, I love what you said about just making sure that people understand, both in the oncology world and in the patient world, that clinical trials do not have to be just your last ditch effort. And I do feel that is something that we all need to be advocating about, and we all need to be talking about, whether we're doctors or we're patients or we're researchers or we're advocates, because what really tipped the scales for me was I was coming from a place of almost total ignorance about clinical trials. I thought if you're in a clinical trial, it's because you have exhausted all of your other options. It means that you might get randomized, so you might not get treated at all. I had no idea about that most clinical trials for cancer are not randomized. I did not know that you would still be receiving the standard of care. I had to really educate myself and fortunately get that education with my doctors. But the tipping point for me was the fact that my doctor, my new immunotherapist, said to me, we are hopeful about this for you. We really are optimistic that you are a good candidate and that this will work for you. And even though that is always at best a guess for any patient, you never know what the outcome is going to be. Certainly in our kind of treatment, there are a lot of people who don't have the success that you and I, Stephen, have been wildly fortunate to have. But to feel like you're coming into this with a place of, I believe this can work. My doctors believe this can work. This isn't just, well, we'll throw something against the wall and see if it sticks, but there is real evidence and science coming with you into this process is really important. And to understand that clinical trials, by the time something gets to human subject trial, it's because there is a lot of promising evidence that it will work on you.
Mm-hmm. Maria-Elizabeth, since you're a writer, I'm just curious if this kind of process of self-advocacy, did it sort of reframe your diagnosis? In other words, allow you to find sort of new language or new ways to kind of describe or define your status throughout treatment?
Well, I was writing about my cancer experience from literally the day after my first diagnosis, because I guess that's my way of understanding and interpreting my own experiences of the world. So my readers at Sloan were with me every single step of the way, from my first diagnosis and surgery to my re-diagnosis when it really looked like I was going to die very soon, and what it felt like to be facing possibility of very imminent mortality, to becoming this subject in a groundbreaking clinical trial. And it really has educated me. And I think it's so important to get educated, but it's also important for those on the other side of the table to know most of us are coming at this with, as you said, Stephen, we don't know necessarily what stage 4 is. And very often when we're getting that stage 4 diagnosis, we don't know what that means. We literally don't know what that means. We don't know what it means when you're talking about our Clark levels, or you're talking about, we get a report that says, our blood levels are this, or our T cell count is this, and to not make assumptions about the depth of our own knowledge and our information. We as patients have a responsibility to educate ourselves, but realistically, we didn't go to med school, and there's a reason for that, because we've got other stuff that we have devoted our time and our energy and our education to. So in the same way that I would hope, think about the amount of research you do before you buy a new television, right? Think about what you do before you buy a new car, before you even decide what you're going to watch on Netflix for the night. To assume that I think to just kind of give ourselves the task that we have to educate ourselves about our health, about the treatment plans that are out there, because it's not necessarily a given that our doctors or our hospitals have a whole lot more information and knowledge than we do. I'm curious, Steve, this was a life-changing experience for you, not just in terms of your personal life, but in your career. You've made this your passion and your mission in life, so it obviously changed your vocabulary as well.
Yeah, to kind of expand a little off what you were talking about, while research is so important personally to me to know what's going on, I think the advocacy part of it is a whole nother monster, and it makes me think of what an advocate even really is. Is it someone who just asks a lot of questions and relays that information, or is an advocate someone who, much like myself, won't shut up until someone listens? And I think it's a brilliant combination of both. It's been such an honor, not to necessarily have cancer, but to see where this whole journey has taken me. I kind of said earlier, just interacting with patients has become a passion of mine. And that was never something I thought, I never in a million years thought I'd be working with patients and holding hands and guiding people into different treatment paths or, side effect management. So becoming an advocate for my fellow patients has just been, I think, when I finally do leave this world, I think that'll be one of my moments where I'm just so proud that I was able to affect other people's lives and educate them and hopefully create a little army of little me's that are going out into this cancer world and educating other patients, because it shouldn't stop at one patient. I think that to truly be an advocate, you need to take the information and the skills that you've learned and transfer that to a newly diagnosed patient and hope that they'll do the same. And I think that's one way that we will defeat cancer, and that's togetherness. And advocacy definitely brings us to that point, I think.
So thank you. We just have time for one question from the audience. Someone asked, and it's actually very much along the lines of what you were just discussing. Do you think it's important for patients to advocate for each other and to take that a step further in terms of more practical advice? Where would you recommend that people look for information or look for definitions? Mary Elizabeth, do you or whoever would like to.
Mary Elizabeth, I was going to say, let's pass it on over to you.
Yeah, well, a great starting resource is, of course, the Cancer Research Institute. There are a lot of great guides to the terminology right on the CRI's own website. It is hard. It is hard to get information. Any cancer that you are diagnosed with, you will probably find a lot of great organizations that deal specifically with your form of cancer. It's great to get in touch with them and to start immediately attending events and talking to people and asking questions, not just of your doctors, but of fellow patients, because your doctors really won't necessarily be the ones who tell you what the side effects feel like. And your doctors won't necessarily be the ones who can tell you how treatment is truly going to disrupt your life, and fellow patients will. And for any cancer, there is a community, and they're usually under the umbrella of organizations that are doing work for that community and doing work for research in it. It is confusing. It is a difficult time. It is especially difficult if you are looking into clinical trials. I am constantly disappointed in the ease with which people can get information about it, and also just asking at your hospital, asking your doctor, saying, I would like more information. And that does not mean a handout as you've got your hand on the doorknob, but I would really like to sit down, find out if there is a patient advocate at your hospital, find out if there are people who liaison specifically with patients. More and more facilities are doing that. And if they have those resources available to you, by all means, take advantage of them.
The Cancer Research Institute, when I was first diagnosed and started looking into immunotherapy, was a huge, huge resource. And it was incredible to partner with them on different events and really kind of help spread that message of immunotherapy to the common patient. And I would also like to say, every cancer has some sort of foundation or support group, and all it takes is a quick Google search. No matter what cancer it is, they are out there for you, and then people are out there who feel your pain and have walked your walk, and they're going to be there for you. Now, I think to the main question, is it important for patients to advocate for each other? I think it's vital. I work a helpline 4 hours out of my day, Monday through Friday, and I can't tell you how many calls are from people who have literally no idea what's going on. Their doctors are not educated enough to know the advances in medicine. So it is imperative that as human beings, not just patients, but as human beings, we take care of each other. And if someone can't process the information that's out there, it is our responsibility to help them and break that information down into terms that are very easily digestible. Because you go to clinicaltrials.gov and you'll be there for hours without any information. It's a mess. And
it's such a mess.
It is, and it's one of my major complaints. It needs to be accessible to the common people of the world, like myself. I'm not a research person at all, and so when I go there, I had someone else give me the skills to break that information down. So yes, as patients, as people, as human beings, we have to start being there for each other. And if that means breaking information down, if that means getting on the phone and just talking with each other, it's vital that we do that.
Yeah, you are entitled to that. As a patient, you have a right to ask questions. You have a right to keep asking them until you get a satisfactory answer. You have rights. You should always feel entitled to the best possible care, to attention, and to respect.
Yes, and I also want to say on behalf of Cancer Research Institute, it's very important to us to have conversations like this one, but to also really base what our programming is on, what is kind of needed in the communities. Webinars and conversations like this are just so valuable. So I wanted to invite you both just to share any other closing remarks, since we unfortunately are running out of time today.
Stephen, you want to take it first?
Sure, I sure will. Speaking to specifically the colorectal cancer community that may be watching this, the Colorectal Cancer Alliance is much like the Cancer Research Institute. We're here for patients and education. So if you're facing a diagnosis and if you don't know who we are, I definitely encourage you to visit us. Our website is ccalliance.org, or you can just reach out to me via email. My email is sestrada@ccalliance.org. We build our foundation with our 3 pillars of patient and family support programs, research, and prevention. And we would love to have any of you watching who want to be a part of our efforts to knock out this senseless killer in our lifetime. We would love to have you on our team. And again, I just want to thank the Cancer Research Institute for really putting the money where their mouth is. Not every foundation does patient-centered webinars like this and patient education like they do. And it's just, it's incredible to watch them grow over the years, and it's incredible to be a part of it. So thank you very much.
Thank you.
Yeah, I'm a Gilda's Club ambassador. Gilda's Club has branches and clubhouses all over the country. And what I love about Gilda's Club is that the motto there is come as you are. And I think often when we are facing a cancer diagnosis, many of us feel we have to put on our bravest and best face, and we have to really game face it through our jobs and our families. And it is really important to remember that this is a very scary experience. It is a life-altering experience, and it is okay to have good days and hopeful days where you feel like, yep, I'm going to take on the world. And it's okay to have days where you're like, you know what, cancer just sucks and I hate this. It's fine. Whatever you are feeling in your experience is valid, and the treatment aspect of it, the organizations like the CRI make it so much easier, so much better for all of us. And then also make sure you're taking care of your mental and emotional health, because we need you. Whoever you are, we need you.
We need you.
Well, thank you both so much for your insights, for this engaging conversation. I know I learned a lot, and I hope that everyone who's watching learned a lot as well. For more of our webinars and additional resources we have for patients and caregivers as part of CRI's Answer to Cancer Patient Education Program, we encourage you to check out our website at cancerresearch.org/patients. Here you can read and watch stories shared by others who have received immunotherapy treatment across. You can browse our entire library of past webinars featuring the world's leading immunotherapy experts and find help locating an immunotherapy clinical trial. We also encourage you to register for an immunotherapy patient summit near you. Our 2 remaining summits are free half-day events which provide patients and caregivers an opportunity to learn about immunotherapy, engage with experts, and connect with each other. You can visit cancerresearch.org/summit to learn more or to register. And finally, I'd like to thank our sponsors one last time for making this webinar series possible. You can watch all other webinars on our website at cancerresearch.org/webinars to learn more about immunotherapy options in a number of cancer types. So again, Mary Elizabeth and Stephen, I just want to thank you again so much for taking the time to share your experiences and insights with us today.
Thank you so much for having us.
Yes, thank you.